I'm Clarke, I'm an osteopath and I'm director of the Clarke Clinic in Liskeard and Saltash. Osteopathy is a form of healthcare specialising in muscle and joint pain, diagnosis, treatment and rehabilitation. Osteopathy takes a look at people as individuals, looking at their lifestyle, diet, occupation, activities, and any medication, any previous injuries, and thinking about those things all together and thinking about people as individuals and what's led to the reason they come to see me in pain. So it's not always that. So as an osteopath, I don't just look at someone's elbow pain. I think about what's led to that. Is it that they've got a lack of activity or a previous injury there? Or could their medication somehow be affecting that? So we're trained to differentiate between muscle and joint problems and other diseases. Prior to becoming an osteopath, I had my own business and I was confident to set up my own clinic as I qualified. So I set up my own clinic straight after qualifying as an osteopath. I qualified as an osteopath in 2019. I studied at the College of Osteopaths in Boreham Wood and Middlesex University in Hendon for 5 years. Studying at the College of Osteopaths was a really good place to train because there were lots of different osteopaths there with lots of different perspectives on osteopathy. So their philosophy was very different, and people that train at the College of Osteopaths can sort of form their own way into osteopathy. So if you went to see two different osteopaths, you'd have two completely different experiences, most likely. Because osteopaths are quite individual. It was brilliant studying at the College of Osteopaths, although a big commitment. So in my year, I think altogether throughout the 5-year degree, there were about 30 people who started the degree and only 9 people finished the degree. So most people at the College of Osteopaths had full-time or part-time jobs on top of studying. So during my degree I worked 90 hours a week, pretty much for 5 years. The hardest part about being an osteopath is that some people think that I'm a magician, but I'm not a magician and I can't make everyone better because it's generally a relationship between me and the patient needs to conform to do some certain activities to be able to get better, so it's not always on me. The thing I like most about my job is helping people in pain and that are suffering mentally, physically, and sometimes I can help people with other diseases as well by recognising they're coming to see me with non-musculoskeletal symptoms, which I refer to GPs and other healthcare practitioners. Typical work day at the moment, I start work, I probably get into my clinic about 7 AM in the morning, clean my room, make sure I'm ready, turn on my computer. I see my first patient around 8 o'clock, I see about 4 or 5 patients, have a lunch break, and then another 4 or 5 patients, so I'm working quite long days. As an osteopath, I offer quite long appointments compared to most other osteopaths. I rebranded Clarke Osteopath to the Clarke Clinic because I wanted to offer more healthcare services alongside osteopathy. So currently we're offering massage therapy as well as osteopathy, and in the future I hope to be able to incorporate more healthcare services. So we have 2 clinics, one in Liskeard, one in Saltash at China Fleet Country Club. People can find us online. We have online booking on the website. Our website is www.theclarkeclinic.co.uk.